Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. And in today's episode, we're going to be talking about kiddos, our pediatric patients. Now, for some of you, that might make you cringe, and for others, this is right up your alley. So, depending on how you feel about children, they are a large part of our population that we treat depending on the type of environment that we work in when we become a dental hygienist. So, it's really important for you to develop the skills on developing patient management skills with these little tykes that come into your operatory. Because remember, we treat two different diseases. We treat dental caries and we treat periodontal disease. So dental caries is the most common chronic disease in our children. So it's really important for you to develop the skills that you need in order to properly care for these guys. And it is 5 times more common in childhood to have dental caries, even more than asthma. So think about that. It's the number one reason why kids miss school, and more than 40% of kiddos have experienced cavities by the time they even reach school age. Now, some of it comes down to access to care, and that pains me to say in this day and age that we still have the highest incidence of dental disease in children associated with low income, special needs access, and ethnic minorities. A lot of providers don't feel comfortable or confident enough to have the skills to treat some of the dental disease that this population has. So it's really important to remember the importance of that primary dentition. And I know that you learned this early on in dental school. So think about it for speech, for proper chewing, to provide space, to develop confidence, right? That emotional development and appearance is important even in the primary years. And we all know the importance of proper speech development. And those teeth provide that important piece as the tongue is learning how to move to develop good speech patterns. And I have to say, the chronic pain and discomfort that comes from caries is significant. If you've ever had any kind of oral pain, you are aware that that kind of chronic infection weakens the immune system, causes missed school days, missed work days because of dental caries. So this is completely preventable. And boy, if I think about myself getting a toothache, I can't imagine what it must be like for a child. It causes eating issues, sleeping issues, and like I said, speech challenges. And when we have to put our kiddos on any kind of antibiotics or pain medications, that just increases their risk of other problems. And it's also an embarrassment for them with their peers at school to say that they have a toothache, or they have shame associated with maybe a malpositioned tooth or a tooth that doesn't look quite the same as the rest of their teeth. And the shortage of care, there's not enough trained dental professionals to work with small children, and so that becomes a barrier for some of these kids to obtain or access the proper care that they need and deserve. It's also important for you as students to know how childhood caries is transmitted so that you can educate your patients. A lot of people are not aware that moms can transmit caries to their children, and caregivers can transmit it to the children. Brothers and sisters, siblings can transmit childhood caries to one another. And how does this happen? Well, when we share drinks and eating utensils, sometimes we test the baby's food to make sure it's not too hot or not too cold, or when we clean things for our kids and give them to them, or when we're showing love and affection by giving them kisses, right? So these are all the ways that we transmit that caries disease. Now remember, when a kid is born, the mouth is considered sterile. And so that colonization of the dental flora begins. And usually, as you guys know, the eruption of the primary dentition starts at about 6 to 12 months and ends between 33 and 36 months. And that entire process of the colonization of the dental flora begins. Now, around 12 months of age and by at least 18 months is the highest risk for infant colonization, and that carries bacteria to appear in the mouth. And this is where rampant caries can be seen in early childhood. And we know that it comes directly from nursing bottles that contain things like sweetened milk, juices, or other fluids that contain sucrose, especially if a child is provided that bottle routinely or when they go to bed. Sometimes pacifiers are dipped in sweet agents, which is also not helpful for early childhood caries, as it feeds those pathogens and bacteria to grow the biofilm and cause that acidic environment. And also prolonged breastfeeding, depending on what the mom has in their diet as well, can contribute to the makeup of the breast milk. But the prolonged breastfeeding, anytime that child is exposed to eating, they're exposing their mouth to a very acidic environment, and so that can increase their risk. As the baby sleeps, those fluids in their mouth pool around the teeth and mix with the saliva. And remember, 5.5 pH is that key piece. When the pH stays around 5.5 or lower, this causes the demineralization process to begin. And that's something that's just going to become a routine number for you to know, like the back of your hand. That's probably going to be a board question of some kind in some case study for you. So it's just best for you to learn it now. And it's also helpful for you to be able to explain this to parents. A lot of parents don't realize that once you put something in your mouth, the nutritional digestive process starts. And so the pH naturally drops in the mouth. And when it goes below 5.5, the demineralization process happens. And it takes about 20 minutes for that pH to come back up to get you out of that demineralization zone. So it's really important for us to explain that to our patients. And the other thing with the primary dentition is that the construction or the enamel makeup, the matrix of those teeth are just not able to withstand the amount of demineralization and acidic environment as a permanent tooth. And usually the maxillary primary anterior teeth are the first that are affected by early childhood caries. So you can see how that would bring with it some shame in grade school with their peers. And also the maxillary posterior teeth. The reason why is just because of location, and if you think about how they eat food and with the bottle and everything, those early childhood caries, those are very susceptible regions right in the cervical areas of those teeth, and they're readily visible to peers, so a lot of kiddos are embarrassed by this. So it's good for us to teach ahead of time to prevent those unfavorable conditions such as dental caries. And boy, parents love the education for overall health care for their children, especially those pregnant moms. They're like a sponge when you start talking to them about how to reduce their risk and manage the nutritional recommendations for their kiddos. When we're trying to guide them in the prenatal stage, it really helps them to prepare to care for their child's oral health right from the beginning. Now, depending on the age of the child is how you want to cater your educational recommendations. Like how you explain to them about diet and snacking and fluoride and things like xylitol chewing gum. Obviously, this has to be age appropriate. Starting with educating the parents on things like bottles at bedtime, only giving the child water, and really developing those good habits from the beginning is super, super helpful. And the other thing that parents might not realize is that even if your child doesn't have teeth, the gingiva needs to be cleaned because of that bacteria transmission and getting the child used to having something put in their mouth to do that mechanism, that mechanical movement. And if the child is sick at all, a lot of kids get ear infections or some kind of congestion. And if they're on any medications at all, it's really important for them to have their teeth brushed after they have a medication dose. A lot of those medications are liquid medications that also have some kind of sweetener in them. So it's really important for that oral hygiene to be done as well. And then the other thing that's good to educate parents about is when to take the child to the dentist for the first time. And it really should be when that first tooth erupts, around 4 to 6 months of age. And what's interesting is it really helps us to connect the family together on the risk assessment. So if the older sibling has already established a relationship at the dentist and now you have a younger sibling who's 4 to 6 months old and you have them coming in, you can help the parents understand that transferability is an essential piece that they have to consider with that child's risk assessment. So identifying the parents, the infants, or the siblings that are at risk and putting the whole piece together so that you can help the whole family evaluate their oral hygiene needs, what their home care assessment should be, the amount of fluoride they should have, ask questions about their diet, so you can treat the whole family together as a team. So that is the recommendation when that first tooth erupts, because it really helps you with that anticipatory guidance that you can provide the parents and the child based on their age that's age appropriate. So things like telling the parents that you can clean the oral tissue with a soft cloth or a toothbrush using water only when they're really young, 6 months or younger, and emphasize the need for daily biofilm removal with the infant and the other family members. Think about asking the parent about their fluoride and if there's naturally occurring fluoride in their water. Do they have well water? Are they on town water? Also support the parents if the child is teething or is about to go through a teething issue. Tell them what to look for with the bulbous tissue around that eruption area. Notice if there's additional salivary flow or drooling, or if the child is seeming extremely irritable, or if there's a change in the way that they're eating. They'll start putting things in their mouth a lot and increase their desire to chew. And they might even notice a change in the child's temperature. They might be running a little bit of a fever. So these are some of the things, if the child comes to the dentist, you can share that information for the parents. And if a child is in your chair and they're currently teething or showing all those signs for teething, you can help the parent understand some of the chewable objects that they use to apply pressure, and that the parent themselves can apply some slight pressure with a cold washcloth. You could also recommend some topical anesthetic to relieve some of those local irritating areas to just give some relief to the child. And the whole purpose of that first dental appointment is not to go through like a routine prophylaxis. Think about the most important way to spend your time with that patient. It's really to develop rapport, explain the goals to mom and dad, have that developing of relationship. Be positive with the patient. Think about the fact that all of the sights, smells, and sounds are new to this little 6-month-old child. I always called the first few appointments the L&R. I would say that to the front desk. We'd call it a look and ride. If I could get the child to play with the suction, to squirt the air water syringe, to get up in the chair and to go for a ride, I would have them take the air water syringe and fill the cup up with water and then suck it out with Mr. Thirsty. If I could get a child to do that the first 2 or 3 visits, by that time that they've developed trust with me, they have all of their teeth in there and they're ready for me to do something meaningful that they might need at that point. In those early stages, it's all about developing rapport. And if you can build trust with that child, you can go a long way at helping them meet their oral health needs. Remember to take a look at everything. Take it slow. Read their body language and don't push too hard, because it's really important for you to think about that child who might have a trauma. And because you've spent the time with them and all of a sudden their parents call with an emergency and they've had an accident and they've traumatized one of their teeth, when they come in and they see you, who's a familiar face, that's going to go a long way. because sometimes things happen and they need that familiar face and that trusting person that they can rely on. And you can be that person. To be honest with you, the hygienist is poised to be that exact person. I want you to be confident in working with children and know that they're looking for your cues on how to behave in the dental environment. It will go a long way if you are completely confident in what you're doing to help show them how they can be confident in what their role is when they're sitting in the dental chair. So put your patience to the test. If you are someone who gets a little worried when you think about having a little child in the chair, fear not. You can do this. And if you're someone who this is your cup of tea, maybe you can support your peers by giving them some guidance on some of the strategies that you're using to make seeing a kid in the chair more meaningful for both you and for them. I hope this information helps you. It's not easy for everyone, but you can do it.